Hi friends, in ECG Basics, today I will talk about ECG changes in right atrial enlargement. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. Coming to right atrial enlargement, the ECG criteria for right atrial enlargement is usually the right atrial enlargement produces a peaked P wave, that is P pulmonale, with an amplitude. If this amplitude of the P wave is more than 2.5 mm in the inferior leads, that is lead 2, 3 and AVF, and if the amplitude of the P wave is more than 1.5 millimeter in V1 and V2, then we call it as a right atrial enlargement, that is more than 2.5 mm in inferior leads and 1.5 mm in V1 and V2. A right atrial enlargement is also called right atrial hypertrophy or right atrial abnormality. The P wave changes in the right atrial enlargement are usually seen in lead 2 and V1. In right atrial enlargement, we will get high amplitude of the P wave in lead 2 and V1. Causes of the right atrial enlargement are usually pulmonary causes, pulmonary hypertension due to chronic lung disease, that is pulmonale, tricuspid stenosis, congenital heart disease like pulmonary stenosis, Tetralogy of Fallot, and primary pulmonary hypertension. Let us take few examples. Here we can see the right atrial enlargement. We can see high amplitude of the P wave in lead 2, that is more than 2.5 mm in lead 2, also lead 3 and ABF. So this is suggestive of right atrial enlargement. ECG changes in the right atrial enlargement is also called P pulmonale. In this we can see in V1 and V2 the amplitude of the P wave is more than 1.5 mm. So we usually see the P wave in lead 2 and V1. Here the amplitude of the P wave is more than 1.5 mm in lead V1 and V2, and in the previous slide the amplitude of the P wave was more than 2.5 mm in inferior leads, that is 2, 3 AVF. It is the lone worker who makes the first advance in a subject. It is said by Alexander Fleming. With this, I conclude my today's topic. Keep learning. Thank you.